Dr. Violin, MD, a medical expert, shared that every day in the hospital, she encounters cases of liver disease. Sometimes, she can recognize warning signs the moment she enters a patient's room. These signs can manifest as strange lines on fingernails, an unexpectedly swollen abdomen, or even a distinctive odor on the breath, things that most people overlook. However, for an experienced doctor, these are clear warnings about liver health. Today, I will help you relay valuable knowledge from Dr. Violin, MD, focusing on the 12 most important signs of liver disease that you can self-check at home. Let's explore, because this information could safeguard your health or that of your loved ones. According to Dr. Violin, MD, the liver can't speak up when it has problems, but the body essentially sends signals on its behalf. These signs can appear on your nails, skin, abdomen, and even minor blood vessel changes. If you pay close attention, you can recognize these subtle warnings and have a chance to detect the disease earlier. Magnifying glass fingernails, a reflection of liver health. Fingernails are not only about aesthetics, they also reflect the condition of the liver. Dr. Violin MD shares that there are 3 characteristic signs on fingernails that she often sees in patients with liver disease. Merca's lines. These are pairs of white lines running horizontally across the nail bed and may be a warning sign. Interestingly, these lines do not move with nail growth because they are actually located in the tissue underneath the nail. If you press lightly on the nail, they might temporarily disappear. This is a sign that the albumin level in the blood is low, a condition common in patients with liver failure. Terry's nails. When looking at your fingernails, you may notice a significant change in color. If your nails become pale and lack pinkness, the blood supply to the nail area may be reduced. Instead of a healthy pink color, the nails become whitish, leaving only a rim of color at the tip of the nail. This occurs due to changes in the nail bed and is often seen in patients with cirrhosis or chronic liver failure. Clubbing, spoon nails, a simple test you can do at home. Press 2 index fingernails together. If you do not see a diamond-shaped gap between your nails, you may be experiencing clubbing. This results from an increase in connective tissue between the nail and the fingertip, making the fingers appear round, thick, and clubbed. Clubbing is not only related to liver disease but is also a sign of chronic lung disease or cardiovascular issues. Drop of blood, skin and abdomen, obvious signs of liver disease. One of the most easily noticeable signs of liver disease is changes in the skin and abdomen. When the liver encounters problems, the body loses the ability to filter and process toxins normally, leading to the following abnormal manifestations. Jaundice, yellow skin and eyes. When Dr. Violin MD enters a patient's room, one of the first things she notices is the color of the patient's skin and eyes. Yellowish skin or eyes turning yellow can indicate that bilirubin levels in the blood have increased. Bilirubin is a byproduct of red blood cell breakdown, and if the liver cannot process it properly, this substance will accumulate in the blood, causing the skin and eyes to turn yellow. Ascites, abdominal distension, swollen belly. If you notice your abdominal circumference growing larger without the usual weight gain, pay attention, you might be accumulating fluid. In advanced liver disease, pressure in the portal vein increases, causing fluid to leak into the abdominal cavity. Some patients can accumulate up to 15 liters of fluid in the abdominal cavity, causing shortness of breath, tightness, and a heavy feeling. In severe cases, doctors have to perform paracentesis, draining fluid from the abdomen, to provide relief to the patient. Caput medusae, prominent, winding abdominal veins. Liver damage obstructs blood flow through the portal vein, forcing blood to find alternative routes back to the heart. The result? The small veins in the abdominal wall dilate significantly, becoming visible under the skin, creating an image similar to snakes around the abdomen, known as caput medusae, Medusa's head. Easy bruising. Easy bruising. If you notice that your body bruises more easily than usual, it could be a sign of decreased platelets and coagulation factors, which are normally produced by the liver. Extensive, slow-healing bruises can be a warning sign that your liver function is seriously impaired. Thermometer signs related to blood vessels and hormones. The liver is not only involved in filtering toxins but also plays a vital role in maintaining hormonal balance. When the liver does not function effectively, Hormones in the body can become imbalanced, leading to visible changes on the skin. Palmar erythema, red palms. Dr. Violin MD often examines the patient's hands during a physical exam. If you notice redness on the palms, particularly in the thenar and hypothenar eminences, thumb and pinky finger areas, while the center of the palm remains relatively normal in color, it could be palmar erythema, a sign of elevated estrogen levels because the liver is unable to eliminate this hormone from the body. Interestingly, this phenomenon can also occur during pregnancy. So if you are not pregnant but still have red palms, consider getting your liver health checked. Spider nevi, spider angiomas. You can try to check for this sign at home. Use your fingertip to gently press on an area of skin with a spider-like blood vessel pattern. If it disappears upon pressure and reappears when you release your finger, it is a spider nevus. These are commonly seen on the chest, face, neck, and arms. They are caused by elevated estrogen levels, a condition often seen in chronic liver disease. Advice from Dr. Violin MD. Many patients are hospitalized without realizing that their body had been sending warning signals for a long time. Don't wait until it's too late. Take the time to examine your body. Sometimes even a small change can reveal a major health issue. Have you checked your body? If you have any of these signs, don't ignore them. See a doctor to protect your liver health before it is too late. Revolving light 2. How does liver disease affect muscles and the nervous system? After discussing the signs on the skin, fingernails, and abdomen, Dr. Violin MD continues to warn that liver disease not only affects appearance but also has a profound impact on muscles and the nervous system. If you ever feel your body getting weaker, experience hand tremors, or notice memory loss, your body might be sending out distress signals. Biceps muscle wasting. When the body consumes itself due to a weak liver. Dr. Violin MD emphasizes that one of the most alarming signs of liver disease is muscle wasting, also known as muscle atrophy. Try to observe your hands and limbs. If you notice your muscles shrinking gradually, feeling like skin covering bone, it could indicate that your body is no longer able to synthesize enough protein, an important function of the liver. Patients may feel weaker, tire more quickly, have difficulty lifting heavy objects, or even notice their arms and thighs becoming flabby while their abdomen remains swollen. According to Dr. Violin, MD, muscle wasting in liver disease is not only a cosmetic issue but also increases the risk of falls, impairs motor function, and makes it difficult for the body to recover from illness. Hand with fingers splayed dupuytren's contracture, when the hand loses flexibility. Another specific sign of liver disease is hand contracture, also known as dupuytren's contracture. You can try the following test. Extend your hand and try to straighten all your fingers. If you find that one or more fingers are bent down and difficult to straighten completely, the tissue under the skin of your palm might be fibrosed, causing your hand to gradually contract over time. Dr. Violin MD explains that this condition is related to changes in collagen levels in the body, a common issue in patients with chronic liver disease. Although it does not cause immediate pain, dupuytren's contracture can limit hand movement over time, causing difficulties in daily activities. Brain hepatic encephalopathy, when toxins attack the brain. One of the most dangerous complications of liver disease is hepatic encephalopathy. According to Dr. Violin, MD, when the liver is no longer able to filter and eliminate toxins, harmful substances like ammonia will accumulate in the blood and enter the brain, causing a series of dangerous neurological symptoms. Raised back of hand asterixis, uncontrollable hand tremors. One of the most easily recognizable signs of hepatic encephalopathy is asterixis, also known as flapping tremor. You can check yourself by extending both arms forward and keeping your wrists straight. If you notice your hands shaking rhythmically, like flapping wings, this is a sign that your nervous system is being affected by toxins in the blood. Dr. Violin MD says, many patients don't realize their hands are shaking until I ask them to hold their hands up. This is not only a sign of liver disease but also a warning that the brain has begun to suffer damage. If left untreated, hepatic encephalopathy can lead to disorientation, confusion, and even coma, an extremely dangerous condition. Face with mask fetor hepaticus, when breath becomes a danger signal. There is a particular sign that Dr. Violin MD always pays attention to during examinations: the patient's breath odor. Have you ever met someone whose breath had a sweet, slightly fruity smell but with an unpleasant metallic or musty undertone? This is fetor hepaticus, a sign that the liver is no longer able to remove sulfur compounds from the blood. These compounds are excreted through the lungs, creating a distinctive breath odor. Dr. Violin MD said, "I can recognize patients with liver failure just by talking to them for a few minutes. Their breath has a very special smell that we call fetor hepaticus. When this odor appears, it's a sign that the liver has significant damage." Right finger words from Dr. Violin MD. Liver disease doesn't only affect the liver but also impacts the entire body, from muscles, hands to the brain. Don't wait until dangerous symptoms appear before seeking medical attention. Listen to your body now. If you notice any of the signs above, go for a checkup quickly. The liver can silently endure for a long time, but when it speaks up, it is usually when the disease has progressed far. Revolving light after learning about the warning signs of liver disease, its impact on muscles and the nervous system. Dr. Violin MD emphasizes that understanding the causes of liver disease is the key to prevention. The liver has the ability to repair itself, but if it is attacked continuously for many years, it will gradually lose strength and suffer irreversible damage. Most patients come to me not thinking that their liver has problems, until it's too late. So, if you really care about your health, start protecting your liver now. Beer leading cause. Alcohol, the #1 enemy of the liver. Dr. Violin MD said, "If there is one thing I wish people could cut back on to protect their liver, it is alcohol. When you drink alcohol, the liver has to work continuously to metabolize the alcohol, and in the process, liver cells are gradually damaged. Over time, the liver can become inflamed, fibrosed, and eventually lead to cirrhosis or liver cancer. What's even scarier is that you don't have to be an alcoholic to damage your liver. Even if you only drink alcohol at a social level but frequently, the liver can still be damaged over time." Pushpin advice from Dr. Violin MD. Reduce alcohol consumption as much as possible. If you can't stop completely, follow the safe recommendation: no more than 1 drink per day for women and 2 drinks per day for men. Do not drink alcohol on an empty stomach. This speeds up the absorption of alcohol and causes faster liver damage. If you already have liver disease, stop drinking alcohol immediately, because any amount of alcohol can make the condition worse quickly. Hamburger metabolic syndrome. When diet poisons the liver. One of the most dangerous but less noticed culprits is metabolic syndrome, including obesity, diabetes, and insulin resistance. Violin MD warns, many patients do not drink alcohol but still have liver disease, and the main reason is non-alcoholic fatty liver disease, NAFLD. When you eat too much sugar and processed foods, the liver has to store excess fat, and over time, it becomes overloaded. Fatty liver disease does not cause pain, but if left unchecked, it can progress to hepatitis, cirrhosis, and liver cancer. Pushpin advice from Dr. Violin MD. Cut back on sugar and refined carbohydrates, white bread, soft drinks, sweets. Increase foods rich in fiber and protein to control blood sugar levels. Maintain a healthy weight. Just reducing 5 to 10% of body weight can help improve the condition of fatty liver. Exercise regularly. Exercising for at least 150 minutes per week can significantly improve liver function. Microbe viral hepatitis, a silent but deadly danger. According to Dr. Violin, MD, viral hepatitis, BC, is one of the leading causes of liver failure and liver cancer in the world. The most dangerous thing is that many people are infected with the virus but do not know they have the disease. Because the early stages of hepatitis do not have clear symptoms, I have treated many young, healthy patients who do not drink alcohol or are obese, but they have severe cirrhosis. The cause? Hepatitis B or C that they have not known about for years. Fortunately, hepatitis B can be prevented with vaccines, and hepatitis C can be cured if detected early. Pushpin advice from Dr. Violin MD. Get the hepatitis B vaccine as soon as possible. Especially children and people at high risk. Get tested for hepatitis B/C periodically, especially if you have a family history of the disease. have had a blood transfusion, or have been exposed to sources of infection. Do not share needles, toothbrushes, razors, because hepatitis viruses can spread through these items. Shield prevention is better than cure. How to protect your liver from today. After listing the main causes, Dr. Violin MD emphasizes that protecting the liver is not difficult. The important thing is whether you have started taking action from today. 5 golden rules to keep your liver healthy. Checkmark: say no to alcohol, the less, the better. Checkmark: maintain a healthy weight, eat healthy and exercise regularly. Checkmark: get vaccinated against hepatitis B and check for hepatitis C periodically. Checkmark: avoid processed foods, fast foods, high in fat and sugar. Checkmark: drink enough water and supplement with foods rich in antioxidants such as green vegetables, fruits, green tea. We can't live without a liver. But the liver can be damaged for many years without showing clear signals. When you realize it, it may be too late. So, don't wait until the disease appears before caring for your liver. Start protecting it from today. If you have read this far, take a minute to think about your lifestyle habits. Are you drinking too much alcohol? Eating too much fast food? When was the last time you had a checkup? Light bulb: your health is in your hands. Just a small change today can save your liver tomorrow. The liver is an incredible organ with the ability to regenerate. But once it's damaged beyond repair, the consequences can be severe. As Dr. Violin MD shared, many patients don't recognize the warning signs until it's too late. That's why it's crucial to take care of your liver now by making lifestyle changes, maintaining a healthy diet, and getting regular health checkups. In my opinion, protecting your liver is not just a responsibility to yourself but also to your family and loved ones. A small change today can help you maintain a healthy liver for years to come. Listen to your body. It always finds a way to send signals when something isn't right. Fire if you found this video helpful. Don't forget to hit the like button to support the channel. Outgoing mail: share this video so more people can learn how to protect their liver. Checkmark: and if this is your first time visiting Health and Life, make sure to subscribe and turn on the bell notification bell so you don't miss any important health updates. Speech balloon: are you experiencing any of these symptoms? Or do you have any questions about liver health? Leave a comment below. I'd love to hear from you. See you in the next video. Rock it!